Hi, yep. What's up, everybody? Welcome to another episode of Let's Talk About It. I'm your host, Twist Johnson. So grab your substance or your drinks or stay sober minded, if you will. And with that being said, let's start the show. But if you're feeling my vibe, like, share, and subscribe. You can catch me in all handles down in the description below. And before we get into this young lady in the screen with me, we're gonna do the current events that nobody asked for. And today I got a book. I got a book for you guys. That's right. So it's called Spiritual Fitness. It talks about fitness with women, and it's a guide in a biblical maturity environment. It talks about food and nutrition and how to keep the body and the spirit going. It's geared towards mental health. The author is Rich Rollins, D. Men, and Marty Trammell, PhD. You can catch this in Barnes and Nobles or Amazon. The name of the book again is Spiritual Fitness: A Guide to Biblical Maturity. Now, let's introduce our guest today, which is a treat for me. I'm so excited, but I won't ruin it for you guys. So, say your name, where you from, and a little bit about yourself, and then we'll do the pour out and pour up.
Hi. So my name is Katina Glover and I'm from New York. I'm a substance use counselor and a mental health counselor.
Okay, that's it. That was
That's
quick.
it.
Who you want to pour out or pour up for?
I would like to pour out for my sister who's going to be dead for approximately 1 year and 1 month tomorrow. So
Okay, let's pour out for her. What is her name?
her name is Tanya.
Pour out for Tanya. There you go, Tanya. Okay, let's start the show. Today we're going to let's talk about social work and social services providers with Katina Glover. So, Katina, in your own words, what's the difference between a social worker and a social services provider?
Nothing. There isn't any difference. I think they're both designed to serve the public in their best interests.
Okay. Do you feel that because there is talks that there's a difference between social workers and social services providers where social workers feel like you shouldn't be saying you're a social worker if you don't have the following qualifications as a master of social work, a CSWA, for those of you guys who don't know, that's clinical social work associates, or LCSW,
Hmm.
where social services providers are more on the direction of structure where you just guide clients to getting things. For example, would be vital documents that they needed. They needed their driver's license or ID or social security card, birth certificate, the person to guide them to the directions of getting those. You said there isn't a difference. Why do you feel, if you've heard that before, why people feel like there's a separation between the two
I
after
think
hearing that?
I think education is the greatest divider. But ultimately, if a social worker is doing all their work and doing case management and everything, they can help get vital documents too.
Hmm.
So I don't see a difference. And I think that more importantly, we're here to serve and from whatever level that we choose to serve. And whether I have a master's degree or a PhD, I think my goal is to help and I want to help in any way, shape, or form. And I just think that oftentimes education is always dividing us when it should bring us together.
Absolutely. When you're working inside of, I guess the question I want to ask is, what area do you think has the most need? Is it the addiction, or is it the mental health? Is it the diagnosis areas, clinical?
So this is what I was saying. I'm going to tell a brief but important story. So I went into the field of addiction and I was really gun ho and I was very satisfied with my role. And I got to a space where I was helping clients to reach sobriety and abstinence, but they were still presenting with behaviors that would suggest that they were high. And I didn't know what was going on. And again, to keep the story really, really, really short, what I noticed was that we were getting them sober. They were presenting with mental health issues.
Hmm.
And I didn't know what the mental health issue looked like. And so it was the reason why I went back to school to get my master's degree, because I did not know what it looked like. And so I hope that ties into your question. But I think that's so important.
No, it
It's so
definitely.
important.
Going on to the addiction part. People who don't understand addiction would tell someone, their loved ones or someone they care for, if they're struggling, to just stop, get off the drug.
Mm-hmm.
I don't think that they understand that the surrealness is, it's not as easy as it may seem to a person who doesn't struggle. Why do you feel like people who have struggle from addiction doesn't they don't understand how hard it is to wing off of a drug.
So there's so many answers I can give to that. But the first I would like to say the idea of straight to abstinence is weird. The expectation that people can just go straight to abstinence is just wrong. I think people look at addiction similarly to mental health. It's like a moral failure. It's like they stay stuck in the fact that it seems like the person is seeking it out, but what they're really seeking is relief from whatever they're struggling with, and they're looking outside of themselves to get it. And I think that it's going to take a lot of education and a lot more services for people to understand what addiction is and how it's impacting us. We need to change the way that we look at addiction, just the way we have changed the way that we looked at mental health. And I
Right.
still think there's a long way to go.
Like more on addiction, someone who's suffering from drug or substance use, their loved ones, they would create what you call boundaries. Who would distance themselves? Like, okay,
Hmm.
guy or this young lady's done this time and time again. I'm gonna have to love them from a distance. When
Hmm.
someone's suffering, do you feel like it hurts the situation if you distance yourself, or does it hurt the person if you continue to stay in their corner?
I think it's situational. I think we have to take it person by person. You know, some people they thrive in that being separated from their family and they want to bring it back together, so they're going to go after it. You get some people who are going to be super upset and will fall deeper into the addiction because their family have put distance between them. I think it has to be looked at on an individual basis, and that's the best way to help, just individualizing it and helping them from there. I've seen it from all sides, and either way it's sad when you have to put those boundaries in place to in support of your family.
Mm. What have you in your career experience noticed was the hardest drug to recover from?
I'm going to say cannabis.
Weed, like marijuana?
Hmm.
Okay.
Hmm. I think it's often ignored, the withdrawal that occurs when someone is forced to stop using. It's not talked about. We talk about what happens when people stop using alcohol, that it's best to do in a hospital setting. The same thing with opiates. But we don't talk about what happens when someone stops using cannabis, that they've been using it to manage their mental health. And I think it's so hard. And I think with the more of acceptance and legalization of cannabis, it's going to get increasingly harder to be able to help someone who really wants to stop.
Mm. That's actually different. I mean, we're definitely gonna take a look at that one. In the same line of the question, what do you think is the toughest drug to wean off as far as like a return?
Say that last part again.
I'll rephrase it. Like,
Mhm.
what is the drug that usually addicts are most likely to return to after recovering?
It could be anyone. I would say what I've seen a lot is opiates. I've seen a lot with alcohol, and I think alcohol mostly because it's so socially accepted
Hmm.
that people will try to, do it in a controlled manner. They will try to do it secretly. But I find that I would say opiates and alcohol are ones that I see a lot of people return to mostly.
Mm. Being an addiction specialist and mental health specialist, what do you see that ties in together with the mental health piece when it comes?
Poverty, lack
Mm,
of education, lack of resources. We get them sober and we get them stable, and we don't have housing.
mm.
We can't help them get jobs. And so I would say like that's something that's significant, and I can't see how we're going to undo it.
Yeah, coming from the poverty spectrum myself, the mental piece comes from being, I wouldn't say poor, I'll say less fortunate, not having much. For me, it was times that like I felt depressed and I had anxiety about going to schools. I didn't dress well as other people who their parents might have done better. Um, the lack of resources to enhance your education if you were trying to. Everyone's always just saying it, even parenting. Sometimes parents, it was a different day and age where parents would tell you go to do something but wasn't able to show you. They expected the school. to show you. With addiction, you've worked with women, you worked with youth. Do you feel like it'd be easier to can treat mental health at a younger age, or do you feel like when someone gets older, it might be a little bit harder to help them with their stresses? I don't. I'm trying to figure out the question I wanted to ask with
I
that.
I think I hear you though. So I think preventative measures are so necessary, and I do think we should educate children more. I would say that it still is very individual. I've seen people get to sobriety in their 50s.
Mm,
I've seen them get to sobriety at 21. And I've also seen both return. So I think it's very individual, but I do think it's possible. But preventive methods are not used often enough. I think sometimes we get to the adolescence too late.
right. I was having this conversation with another provider. They work for the crisis units, and they were saying that the gang violence is at an all-time high. Not
Hmm.
not saying that in a decade ago it wasn't. But these kids are more privy to picking up a gun and less
Hmm.
from they're reluctant to listening to what we call OGs or a
Hmm.
person who would have like told you, "Hey, calm that down." And it comes from the poverty spectrum, not
Hmm.
having good examples. They were saying that if we could catch them at an earlier age and put people in the schools, put providers in the schools that could be
Sure.
mentors, big brothers and sisters, then it would definitely make a difference.
Sure.
But what about the household? How do we hold the household accountable?
That's a very interesting question. I think that sometimes we don't plan for our families. I
Mm,
know very few people who've actually planned for their families. And I think in the lack of planning, it ends up being lack of providing. And oftentimes, and when I say providing, I'm talking about providing the structure. Oftentimes, it's the older siblings watching the kids as mom goes off to work 2 jobs. Maybe dad left or whatever the case may be. But I just think that there's not a lot of information in the house
mm,
oftentimes, and the parents themselves didn't have education, so it's just a lack of education, a lack of structure, and it's just a lot of lack, and there's not a lot of places where you can go and you won't be shamed for asking for help, because
right.
sometimes when you go to get some resources they make you feel real bad about it and then you don't want to go back. So that's what I would say.
I've definitely been in that seat. Well,
So
I was upset that I actually went to look for help. I felt like I was being judged, and like they
absolutely.
were looking at me in a pity. I know both sides of it. What I want to ask you next is when it comes to like outreach.
Hmm.
Um, New York City, for example, do you feel like there's enough outreach services for people who are suffering from mental health and mental health illnesses?
I think they're overwhelmed. I think they're grossly overwhelmed. And ever since the pandemic, I will say that to get someone into mental health services, it is a waiting list, sometimes up to 3 to 6 months.
Mm,
And so that's what I would say about mental health services and outreach. They're overwhelmed and they don't have enough resources. But more importantly, they don't have enough people of color in positions to help people of color. And I think that's a huge thing too.
right. I do know like other areas that's outside of New York City. I've been trying to do a little research because I myself have felt like, well, where's the diversity and like how can we
Mhm.
help if we not relatable, if we can't identify.
Mhm.
On the outskirts, there are foundations and non-for-profits that help African Americans get in position, but it's limited. It's not so much. It's not on a broader scale. I wish that a lot more of the darker descent would get involved inside of the helper profession and start
Mhm.
studying to be mental health professionals or social services providers, behavior science, if you will. But I feel that people take onto these social medias and become clinical supervisors and clinical professionals by their own right because they're learning the scientific terminology and they're using their
Mhm.
content. But I think it's deeper. It's a deeper science, and it definitely
Sure.
takes education and theory and experience. With the experience and the pain for yourself, how do you take care of yourself as a professional when you're dealing with individuals with mental health? What do you do for yourself?
Unplug, unplug. Set boundaries, make sure I have a good support network around me to talk to, be honest about what I'm feeling. I'm certainly not the person I was when I entered the field, when I didn't practice self-care and I was on this quest to save the world one person at a time. Now I realize I mean, I get to save anybody, but I do have an opportunity to take care of myself in the process. So that could just look like, reading a book, making sure I schedule time off, spending time with family and friends, and not allowing my family and friends to utilize me as a resource, as a mental health counselor, as a
Mm.
substance abuse counselor, setting those boundaries, which sometimes is really, really hard.
Right, it is tough. Like I find myself talking to my sisters. They're in the field now too. So when they're
Mhm.
talking and we're having disputes, I'll say something like, "Well, are we talking? Stop talking to me like I'm one of your clients. Like,
Sure.
am I talking to you or am I talking to you, the
Mm-hmm.
professional?" I
Mm-hmm.
myself, I was a client. I was my own testimonies of just being like addicted to like substances and alcohol and just being a delinquent. When I decided that I wanted to be a part of the helping profession, it was difficult. I started at an early age. I had a lot of great mentors like yourself and other individuals who helped pave the way, but I didn't have the maturity and I didn't have the experience. I still was soaking. So a lot of things came off in a sympathetic aspect than the empathy and understanding that I'm not helping the situation by pillowing. As I started to get more seasoned, I understood that it has to be a mixture. It's passion for peanuts. You have
Mm-hmm.
to be able to have sympathy, but be more empathetic so you
Mm-hmm.
can provide the services as a professional. Do you feel that a lot of the techniques and the things that were done in the past, do you feel like they're effective today?
No, they weren't effective then. We just didn't know any better.
Mm, okay. Well, let's dig more into the addiction part, substance
Mm-hmm.
abuse part. Some people would say that that category inside of the helping profession is watered down. It's not as tough as it was. The therapeutic communities. Do
Mm-hmm.
you feel that way?
I think that the therapeutic communities worked for a time. And as we increased our skills and our knowledge, we could do different things and get the same outcome. I think tough love has its place, but not everybody can receive tough love. And so I think that if I had to describe the OTC community, that's what I would describe it as, tough love. But everybody doesn't respond well to tough love. So as a substance use counselor, I certainly infuse some OTC in there, but it's encompassed with a lot of empathy and a lot of love and a lot of understanding. And it's mostly to somebody who has a working knowledge of what it's supposed to look like. Someone new to coming into treatment now wouldn't know what that is and would very much see it as abuse, if you will. Now, I'm
Right.
certainly not doing anything abusive, but I certainly know how to confront somebody in the TC way and be effective. And so I'm not going to do that with somebody who doesn't have that information, but I would absolutely use some of those skills on someone who has the information and who could be understanding to it.
Right, that part. I have nothing to add to that. I want to ask the question, have a quick conversation about someone that might be dealing with suicide. How do
Mhm.
you get someone in that aspect? Have you been faced with it?
I would say that I've had some touches with some suicidal ideations that seem like they could move to planning, and it's about being honest, and it's about making sure you tap into the resources that are around and being upfront with them. Oftentimes when someone is in a dangerous situation, we try to contain it, but that's not the time you contain it. That's when you look to resources. Like, I'm not afraid to ask a supervisor to come in and check in with me on this situation,
Mhm.
or asking the person, like, who is their emergency contact, like getting that person involved and sort of safety planning around it. I just think suicide is not talked about enough, but oftentimes people don't even know what suicide really looks like and what self-harm looks like, and they're not always the same.
Right. I talked about it on the episode before. Like, if I was faced with someone who was saying that they were going to commit suicide allegedly, and they were on the bridge. I had the training. And I've done a lot of research. In that moment, everything that you're trained for goes out the window. You don't
Mhm.
know what you're going to feel in that moment, and in those moments, I was feeling like anything that I say is going to count. If I say the wrong thing, he's going to jump because he was literally on the bridge and the
Hmm.
car was below him. Everything that I said, he was just on defense. Or what about this? Or what
Hmm.
about that? No one loves me.
Hmm.
And I was scared. I think that was the
Sure.
most scared I've ever been in my life. And I mean, eventually he did come down, but it was about 2 hours that felt like 24. There's nothing that could get you mentally prepared for situations like
Sure.
that.
I agree.
Um, I got two more things just to get off.
Okay.
There's a running joke I started hearing lately that social services providers, mental health professions, shrinks, any area title that they are paid friends.
Mm.
They say that wrong.
Paid friends. Tell me more about that.
They are people that are paid to be your friend and give you constructive criticism.
So I don't view counseling in that way. I don't think that I think you certainly can offer feedback sometimes, but when you're in those settings, oftentimes the person is figuring it out themselves. You just sort of paint a picture for them and you show them patterns. So the advice side of it, like, is very little to me. I think if you're giving advice, you're probably not really listening for understanding. You're listening to solve the problem, whether listen and not listening for understanding. I don't
Mm.
often find myself giving advice in in those particular situations. I'm painting pictures and showing patterns. And when there's time for feedback, I ask for permission. Can I give you feedback about that? Let me tell you how I see what you're saying. So that's something I would say. I don't know about being a paid friend.
Mhm.
I look at when I think of those kind of professions, like the term friend, it could get really interesting when you say that, because certainly you could probably develop a friendship over time, but often it's still going to be a power dynamic. So I don't know about somebody describing it that way as a paid friend.
Right. Yeah,
I've never
I've
heard
heard
that either.
I've heard the joke a few times, like just being inside of the atmosphere now, and
Hmm.
I agree. Like it was almost offensive to me. So like I can
Sure.
only imagine like someone that's sitting in the chair getting services, they already have the frustrations and they already feeling like, well, it's your job to
Mhm.
listen to me. It's your job to help me, let alone that like now as a profession people actually have that mindset. I definitely agree with the other side that you said, is that I don't feel like we're paid to be friends. I mean, who
Mhm.
doesn't want to be compensated? But it's passion, like we have a
Sure.
compassion to help individuals. So yes.
I will say that I just want to add this piece in it too. So oftentimes I find that especially when someone is mandated to services, there's no buy-in. There's no
Okay.
buy-in, there's no belief. And so therefore they are looking like, I wouldn't necessarily say friends, but they definitely look like, let me just come in here and say whatever I want to say because this person is getting paid. But it's the lack of buy-in and the lack of belief in the process that sometimes just often makes a person's process a little bit longer because there's no buy-in. I just wanted
Mm.
to add that.
No, that is actually great. I wasn't thinking about that. Mandated versus self-referred. That is definitely different territory.
Sure.
Um, Wrapping up, like, because I know we pressed on time. What is some advice that you want to give someone who might be thinking about um they might be thinking about taking up the helper profession as a career?
I would say I would tell someone to do self inventory and see what it is within you that makes you want to go in the field, and make sure that you're working on that as you go in the field. Because oftentimes we're going into the field to save what wasn't saved in you. And I think that you need to repair that or start working on repair before you go into the field. Or you could do it simultaneously. That's what I would say. Make sure you're doing
Mm,
that work. Make sure you're doing your inner work.
amen. There you have it. Katina, it was a pleasure to have you. This
Oh,
is definitely something that everyone's going to learn something from. Mental
oh, I
health is
hope
for
so.
everyone, and we're going to continue the conversation. I hope that everyone that views this, they get all the information that they would need. I will leave handles in the description is going to be utilized for the greater of the good. With that being said, that concludes another episode of Let's Talk About It. Don't forget you'll catch an episode every Thursday at 8 p.m. Eastern. You can catch it on Spotify, YouTube, and all surrounding platforms that support podcasts. With that being said, see you when I see you. I miss you. Peace.